Hi, everyone. Welcome to the Stigma Free Society Wellness Chats with Nisha. I hope everyone had an amazing break. It's great to see you all online. And my name is Nisha Kare. I'm the co-founder of Human Biography and Women of Wonder Global. I'm the director producer and at Human Biography and a registered clinical counselor. Through this Facebook Live, I am representing the Stigma Free Society, a Canadian registered charity that aims to reduce the stigma of all kinds with a focus on mental health. They promote mental wellness education for youth and while providing resources for educators, school counselors, and parents and guardians. And the Society's goal is to create awareness of the various stigmas that exist in the world and develop an understanding of the challenges that numerous people face, and encourage people to foster acceptance of not only themselves, but of others as well. And to learn more, please visit thestigmafreesociety.com. And I would like to welcome our guest today, Davina. Hi, Davina.
Hey, how are you doing, Nisha?
Great. How are you?
Doing great.
Fabulous, fabulous. So I'm going to tell everyone a little bit about Davina. So Davina Patterson joined the Disability Resource Network in February of 2020. She's a graduate of the University of Alabama at Birmingham with a Bachelor of Science in Health Administration and a minor in Community Health Education and African American Studies. It's a pretty interesting combo.
It is.
Yes, very relevant. So,
Yeah.
Davina, why don't you tell us a bit about the Disability Resource Network and what the network does?
Absolutely. So, Disability Resource Network, we're the newly established Center for Independent Living in the state of Alabama, and our service area includes 13 counties in North Alabama. Our office is located in Huntsville, but we service the Tennessee Valley, North Alabama region of the state. Our mission is to promote independence in people with disabilities, and we do that through advocacy, public education, and consumer-controlled independent living services.
Amazing, amazing. And so, maybe what are some of the current initiatives that the network is working on?
Oh, wow. So we provide 5 core services. All centers for independent living have to provide 5 core services. So I'll speak about those. The 5 core services are information and referrals. We have peer support. We also do transition services for youth and nursing home transitions. We also do independent living skills training. And the last one is advocacy, and that's systems advocacy as well as individual or self-advocacy. Now, some of the initiatives we're working on, we do have a couple of partnerships with, we have a partnership with Alabama Department of Public Health, where we're providing some COVID workshops and trainings to the community and to consumers, and just to the public organizations and agencies in our service area. We're also partnering with the Disability Vaccine Access Opportunities, where we're working with local health departments to try to provide assistance for people with disabilities that's trying to get vaccines, COVID vaccines.
Oh, wow. So it's really kind of morphing. Your work is even morphing as you...
growing and expanding.
Oh, great. And
We're
then
looking to add more services, but we do have our 5. And like I said, through certain funders and certain funding, we contractually, we do have some additional services or programs that we're providing. And so those are 2 that we're working on at this time.
Amazing. And then you are strictly in the US, or does any of your work kind of trickle into Canada?
Well, so we are located in the U.S. and there are over 400 centers for independent living across the country. So each state has to have one center. So if you're looking for the services in Canada, there may be a center there, but because of the service area and the way that everything is kind of assigned. We have to work within our service area.
Oh
So
yeah, no,
yeah,
exactly.
our center services North Alabama, and U.S. Located in the U.S.
And then what made you, like, what drew you to work with this organization?
Yeah, yeah, I'm glad you asked. So, wow, it's been a journey. Been working in healthcare for over 15 years, and I always knew that I wanted to pursue a career in healthcare. I thought that I wanted to do the clinical side, but when I was in college, I discovered that I really like more the management administrative side of healthcare. So I worked at a couple of hospitals, I had some corporate jobs as well. But my first job, I would say that I started working with nonprofits was in 2015, and we worked primarily with underserved and unserved communities, and I enjoyed working with that population. So when this opportunity came, it was very personal to me. It hit home, and I just developed an interest for it.
Wow. And so tell me a bit about like the work that you do. What's it like working with this organization? And what are some of the things that you feel proud of that the organization does?
Oh wow! I'm extremely proud that this organization doesn't just focus on one disability. We're a cross disability organization. So we provide services to people that have all disabilities. So that's something to be very proud of. But what do I do here? I do everything as far as developing programs, grant writing. We also do a lot of outreach. We responsible for making sure that we receive funding for our centers. And we do a lot of trainings and workshops and things like that.
Oh, fantastic. And then what role does peer support play in the work the network does?
Well, peer support is everything that we do. Peer support is one of our core services. So again, all of the Centers for Independent Living have to offer peer support, and we use the peer-to-peer model instead of the medical model at Centers for Independent Living. So it governs, or it leads everything that we do. Peer support. We're here to support people with disabilities. 51% of our staff and 51% of our board members are people with disabilities, and they provide the services, and they're also a part of the decision making. And they lead most of these workshops and these trainings in the programs that we have.
Amazing. So it is a community supporting itself, like a community all coming together and working together and making, a place where people feel comfortable and they can ask questions and they can have advocacy and they can learn how to speak up for themselves.
Yes, that's very important. We're here to empower people with disabilities. And even, if we do have an expert speaker come in, we want to be involved and engaged in the process or the program. So we want to review the program. We want to be a part of selecting the facility and making sure that people with disabilities are being kept in mind when you're selecting these type of facilities. Is it accessible for people with disabilities? Is the program accessible for people with disabilities? There are people with all kind of disabilities. Yeah. They may be vision impaired, so they may need material that needs larger font. They may be someone with a physical disability, so we may need a ramp, or it may need to not take place on the second level. And if it is the second level, does it have an elevator? So those are things, if someone is blind or deaf, is a sign language interpreter available? Is closed captioning available? So, just being a part of that program, being involved in the process as well.
So many like different examples of people living with disabilities. And so it's like a vast array of the type of people that you would work with and also service. And it just sounds amazing. And especially if people are connecting together, and that you say that, 50% of people that you work with, or that work with the community, are people who are living with disabilities, but showing that, like, there are so many different examples of how we can just support each other and how we
Absolutely.
make it easier for people, like keeping things in mind that are very simple to do, actually, probably many times.
Right. Depending on the person, everyone has their own challenges and their struggles. Um, but we're definitely here to support the individual and to assist them with just the basic skills and functions that they need to operate and function independently.
Yes, yes. Like, it just comes down to people feeling good about even the basics, right? And if we can get access,
Right.
changes the game, right? If we're
Yeah.
all on at least some kind of like equal playing field to start somewhat, it just makes people feel more included. And so, what are some of the barriers that you see, barriers to access that you do see in some of the work that you're doing?
Accessibility is a very uh, key topic in our center. Is something that is just, it's one of those topics that's ongoing, but my staff is very passionate, and myself, we all share the same passion, but we're very passionate about accessibility.
Yeah.
When you speak of people with physical disabilities, the constant fight and struggle to attend assembly areas where they're just not accessible for people with disabilities, and then bringing facilities up to code, like old facilities, just bringing them up to code. That I've heard so many stories, like just trying to go to a restaurant or something, how it's just a challenge, or
Oh,
it could be a barrier for someone with a disability. So yeah, the accessibility, housing is always a issue, as well as transportation as well.
housing as well. Tell us a bit about the housing. How's housing an issue?
Well, in several ways, accessible housing, some of the housing isn't accessible for people with disabilities. And we're going to be working with certain programs to bring minor home modifications to make the homes, bring accessibility in the homes, like maybe grab bars or ramps, wheelchair ramps, just minor home modifications. But some of the public housing, or some of the housing just isn't accessible. That's one issue. And then the second issue is affordable housing.
Yes.
Some people with disabilities live on a fixed income. So when you speak about a safe, a safe place for them to live that's affordable, that's a barrier. That can be a challenge for them.
That could be a real barrier. Yeah. And then,
Absolutely.
why don't we talk a bit about the intersections between disability and mental health that you see in your work?
Well, mental health is definitely, it is a disability. And most people, when they think about disabilities, they think about a physical disability. They don't think
Mm,
about what we call an invisible disability. So you may not be able to see that someone has anxiety or they have depression. That may not be as noticeable as someone with a physical disability. So mental
mm,
health, it is a disability, and it's what we call a physical disability. And I think the more people are educated and know more about disabilities, they'll begin to start looking at the different types of disability. You have, like you said, mental health, you have intellectual, you have developmental, you have so many forms of disability.
And are people feeling more and more comfortable to bring that up or talk about it? Do you find in Alabama, is that something that is, in the workplace, or do people feel that that, like, maybe if it's like an invisible, you
Mhm.
know,
Yeah.
living with an invisible kind of disability,
Yeah.
like you said, that you can't see it,
Right.
do people feel comfortable talking about it, or is it changing?
I think organizations like our organization and some others out there, we're promoting it and making it more, um, making people more confident in talking about it. But it has been something in the past that people, they do steer away from. But I think now, like you said, the world is changing and accepting everyone, and the stigmas. I love the name of your podcast. The stigmas are being removed. So I think now, people are a little bit more comfortable talking about it.
Yes, I think so. I think things are changing, especially with, right, Stigma Free and all these different things that we're starting, especially in this time of like COVID. And I think that people who maybe thought like, oh, mental health issues are for those people over there, really, we're all facing them. There's
Right.
challenges in every realm with everyone.
Absolutely.
Right. So mental health, anxiety, depression, it's really around us. How about how do other identity categories, like race or socioeconomic status, how do those factor into these intersections?
Oh, wow. So so people with disabilities, like I said, they're, as far as the socioeconomic component, they sometimes they are on fixed income, and they may not necessarily have the funds to support or be in a certain, or have certain opportunities, employment opportunities, as others. So it's important for employers to provide reasonable accommodations for people with disabilities. Not all people with disabilities want to live on a fixed income. They would like to have an opportunity to work in a setting where they can live independently and support themselves.
Yeah, that's so true. It's so true. And just having that independence and being able to, have a place you call your own, and
Yeah.
really, really makes a big difference. But then if you're having challenges with getting to work or going to making things work at work, if it's just can be challenging, then how do you get that income? And a fixed income can definitely impact things.
Right. And I think like you speak about the pandemic has changed a lot of how employment is set up. A lot of these companies are realizing, hey, you can work from home.
Yeah.
So, that's kind of a benefit for people. So,
Yes. Yeah, definite benefit. And I could see in so many ways, like we don't have that fear of going out, and we don't have to, we can work from the comfort of our homes, and can make it easier, especially if it's, like physical disability, hard to get around or navigate right now. And but I can imagine that there's also challenges with, because people are home more, not having the opportunity to go out and socialize, or maybe see people, which is probably also adding to the mental stress that we're experiencing. Yeah. And so your organization, I see even on your website, it's really shutting down how people can mix and mingle right now, right? Or coming to the center, it really has, things have changed.
Absolutely. Yeah.
Yeah.
I think it's important that people kind of create that network, friendships, participate in programs that we offer. Like, we have a peer support hour where
Great.
people with disabilities can come together once a month and talk about issues, and just sometimes just be comfortable and just relax and just get to know other people, and it's more like a setting, a social setting, but it's virtually.
Yeah, great. Those kinds of things are very important to people, I think, right now.
Yes, and self-care is so important too. So
Yeah, self-care, I think, is it's everything, and that often we forget what we need to do.
yes.
And it's great that you're doing the work that you're doing. And so so your involvement in the network, when did it start? Davina, tell us a bit about how you got involved.
Oh, wow. So it's kind of complicated, but I'm gonna try to explain it in a way to where it's relatable, and you can kind of walk with me on it. So, Centers for Independent Living, the center that I'm with, it is a new center. So we had to, in order for us to form, we had to meet certain state requirements. So we had to work under an existing center until we met those requirements. So when I started in 2020. with the plan and the intentions of this center that I'm working for to be totally independent. But until we reached those benchmarks and goals, we had to work under another center for independent living. So I worked under that center for maybe a year. In October of 2021, this center, we met our state requirements and we did what we call a spinoff, which means that we're completely independent. Center for Independent Living, freestanding independent center for independent living.
Amazing. And so what drives your passion to support the folks in this community?
Well, it's personal. I think I shared with you off air when I was 17 years old. When I was 14 years old, my twin sister, she complained about some leg pain. She was having very excruciating pain in her leg, and my mom took her to the emergency room and they recommended that she goes to an orthopedic surgeon. So when she went to the orthopedic doctor, he did an x-ray of her leg and he found a mass. And so she went to an oncologist and they did find a tumor. And so she was diagnosed with cancer. And she died when we were 17 years old. So that's always just been something. I wanted to make a difference in the community for people with disabilities. It was just always something that was personal to me, having family and friends that have disabilities, and to be able to work with that community and be genuine and sincere about it.
Yeah, I'm so sorry for your loss. I can't imagine how hard that must be. And
yeah,
first to lose someone in your family, but a twin as well, like that, the connection there. But and just that drove you to do this work and to like be passionate about it. And I'm sure that the people you're working with can feel that and appreciate that, and that you're making a difference. And
absolutely, yeah.
And so
that was the main driving force for me, because when she was on her deathbed, I made a couple of promises to her, and I always wanted to, like I said, make a difference. I always wanted to be a change agent and a visionary, and I think this is the platform, this is the setting that I feel most comfortable doing it in.
Yeah, no, that's amazing. Amazing that you're doing that, and that's like a legacy for your sister.
Absolutely.
Yeah, the work you're doing, it's like in her name and very powerful. And so like, why do you think advocacy is so important in your opinion? Like, why do we need more advocates to like stand up for people and help people in this society?
Advocacy is important. We do two forms of advocacy, and like I mentioned when I did an overview of our core services, self-advocacy is important because you're empowering someone to speak up for themselves, how to speak for themselves, not necessarily relying on someone else to speak for you, but being able to communicate for yourself your needs, your desires, your personal goals. What do you want? Not necessarily what someone else wants for you, but what do you want? So I think that's very important. It's just giving people a voice. And we do systems advocacy, and systems advocacy is the type of advocacy that we do through it may be certain laws or legislations or changes that we want to see in the community. And I spoke about accessibility, making sure that people are aware and they know, and they're keeping in mind that people with disabilities are here, and they should have accommodations. So, both forms of advocacy is important, because that's the only way we're going to be able to provide change.
Yeah, and I think it's brilliant that part of your organization is giving voice and like helping people find their own voice, and also like find out like what do they want.
Yes.
Like, what is it that makes them happy? What do they need?
Yeah.
I think probably in their lives there's been a lot of times where people have told them like, okay, they just say, okay, I'll just take what there is.
Right.
No, it's having that voice to say, this is what would make me feel included or part of something or whole.
Right. Absolutely. And it's good to have parents, it's good to have spouse and educators as resources and support, but it's important for everyone to have their own individual identity and to have their voice and speak for themselves.
Yes, because there's just so much confidence that gets created in that, and also it's more powerful that way, I think, too.
Yeah.
Rather than someone saying, "Oh, I think this person needs this." No, this person to say, "I need this." I
I
think
need
that's
this.
powerful.
Yeah.
It's amazing. And so love the work that you're doing. Very powerful. And Davina, maybe you could tell us how can members, like if members of our audience are interested in getting involved in the impactful work that the network is doing, how can they get involved?
Oh man, we definitely have a lot of opportunities if you want to get involved. If you are interested in donations or just your time, your support, however, wherever you feel the need to join in. But our website is www.drn256.org. You can contact us by email at drnal256 at gmail.com. We also are on Facebook and Instagram. Our Instagram is at drnal256. And Facebook, you can find us on Disability Resource Network.
Okay, amazing. So thanks so much, Davina, for joining us today on behalf of the
Thank
Disability
you.
Resource Network. And to everyone watching at home, please keep in mind that whatever we can do to create an inclusive and thoughtful community, that's the best way to go. So see you next time on the Stigma Free Society. And everyone stay safe and take care.